So what's the difference between an OBGYN and a reproductive endocrinology and infertility specialist, and who should you see? I'm Dr. Sharon Moyeri, owner and founder of OC Fertility, and I'm a reproductive endocrinologist. A general OBGYN completes 4 years of medical school and then goes on to do 4 more years of general obstetrics training, which is the management of pregnant women and the delivery of babies, as well as gynecology, which is the management of women's health, including general gynecology, for instance, well-woman exams, managing pap smears, breast exams, and then following a woman through her reproductive years, including menopause. They might also do outpatient procedures, such as laparoscopy, and handle women's other reproductive concerns. A reproductive endocrinology and infertility specialist completes the same training, but then spends an additional 3 years in fellowship, which is a subspecialty, doing training in reproductive hormones and specifically infertility as well. And this involves training for in vitro fertilization and minimally invasive surgery. So we become specialists in particular in fertility and reproductive hormones related to women and men who are trying to conceive. So in addition to completing a fellowship, the reproductive endocrinologist needs to pass the second test, and so you want to find out if your reproductive endocrinologist is double board certified or not. So a reproductive endocrinology and infertility specialist does become double board certified if they pass both of their training exams, and not all reproductive endocrinologists have become double board certified. So the question is, who should you see? Should you see an OBGYN or your reproductive endocrinologist if you're having trouble conceiving? And it really depends on where you live. Sometimes the general OBGYN is equipped to handle some of your basic concerns, but oftentimes you're going to need to see a reproductive endocrinologist, especially if you're older, and certainly if you're considering more advanced treatments like intrauterine insemination and especially in vitro fertilization. The reproductive endocrinologist spends all day doing these types of treatments, so that's who you generally are going to want to see off the bat.